Reasons for vaginal discharge. Normal vaginal discharge is a healthy and normal physical function. This method cleans your body and protects your vagina. For example, increased secretions during sexual arousal and ovulation are normal. Exercise. The use of contraceptive pills and stress and emotional issues may also lead to secretion. Vaginal discharge is often a natural and permanent occurrence. However, there are certain types of secretions that indicate infection. Abnormal discharges may be yellow or green, with consistency, density or bad smell. Symptoms of vaginal infection. Vaginal irritation. Increase the amount of discharge. Colorization of secretions. Very bad smell of vagina. Continuous itching. Severe pain during sex. Spotting. Irritation or pain when draining urine. If you have a persistent abnormal smell of the vagina and other symptoms or symptoms below, you should contact your doctor. You may develop a severe infection or cancer. Fever. Abdominal pain. Unreasonable weight loss. Fatigue. Increase the amount of urine. In the absence of treatment for genital infections, in pregnant women it may lead to preterm labor, 37 weeks of gestation, and if the abnormal smell of the vagina is due to cancer, it can lead to death. Note: pregnant women are more prone to vaginal odor due to hormonal changes and increased vaginal discharge. Prevention of vaginal odor. Observing personal hygiene. Wearing underwear made of cotton or yarn. Wearing loose underwear. No spray of freshener to the vaginal area. Washing the vagina with non-chemicals, beneficial bacteria should not be eliminated. Protected sex, using a condom and having a sexual partner. Referring to an obstetrician and gynecologist periodically. Have proper nutrition, eating some foods will make the vagina smelly. Note: vaginal odor can be due to some medications. Probiotic supplements and foods, such as yogurt, can help balance the vaginal pH. Using high-quality handkerchiefs. Timely replacement of tampons and less use of tampons. Follow-up and treatment of rare disease, vaginal recto-fistula. Note: vaginas with long labia majors are more likely to smell due to the collection of urine drops in that area, and loose vaginas become more badly affected due to repeated births. White discharge. Low amounts of white secretions, especially at the beginning or end of the menstrual cycle, are normal. However, if the secretions are itchy and have a thick consistency or appearance similar to cream cheese, it is not normal and requires treatment. This type of discharge may be a sign of bacterial infection. Smooth and watery discharge. Clear and watery discharge is completely normal. This condition may occur at any time of the month. It is possible that these secretions arise after exercise, especially heavy exercise. Clear and draw back discharges. When the discharge is clear but stretched and similar to mucus and not watery, this condition indicates that you are probably ovulating. This type of discharge is normal. Yellow or green discharge. Yellow or green discharge is not normal, especially when thick or associated with an unpleasant odor. This type of discharge may be a sign of infection, trichomoniasis. Usually, this type of infection is transmitted through sex. Brown or bloody discharge. Brown or bloody discharge is usually normal, especially when it occurs during or immediately after the menstrual cycle. Late secretion at the end of the menstrual period may look brown instead of red. You may also have small amounts of blood discharge during periods. These conditions are called spotting. If spotting occurs during the normal time of your period and you have had sex unprotected recently, this can be a sign of pregnancy. Usually, spotting in the early stages of pregnancy is a sign of miscarriage. So you should talk to your doctor about this. In rare cases, brown or bloody discharge can be a sign of cervical cancer. This can indicate other problems such as fibroids or abnormal growth. For this reason, annual pelvic examination and pap smear test are important and necessary. Gynecologists in these procedures examine cervical abnormalities. Bacterial vaginosis. Bacterial vaginosis is a quite common bacterial infection. This infection increases vaginal discharge, which has a severe, bad odor and sometimes a fish-like odor, although in some cases it does not cause any symptoms. Women who perform oral sex or have multiple sexual partners have an increased risk of developing the infection. Trichomoniasis. Trichomoniasis is another type of infection. This infection is caused by a single-celled organism. Usually, the infection is transmitted by sexual contact, and it is also likely that you will get it by sharing towels or bathing suits. As a result, yellow or green discharges are created that smell bad. Pain, inflammation and itching are also common symptoms, although some people do not experience any symptoms. Pelvic inflammatory disease (PID). Pelvic inflammatory disease (PID) is an infection that often spreads due to sexual contact. This occurs when the bacteria in the vagina spread to other reproductive organs. In this situation, heavy secretions may be caused by bad odor. Yeast infection. Yeast infection is a yeast infection that produces white and cheese-like secretions in addition to burning and itching sensations. The presence of yeast in the vagina is normal, but its growth can multiply under certain conditions outside of control. The following may increase the likelihood of your yeast infections: blood pressure, diabetes, use of contraceptive pills, pregnancy, antibiotics, long-term use within 10 days. Gonorrhea and chlamydia are sexually transmitted infections (STI) that can cause abnormal secretions. The color of these infections is often yellow, greenish or blue pale. Human papillomavirus, virus HPV, or cervical cancer. Human papillomavirus (HPV) is transmitted by sexual contact. This condition can lead to cervical cancer. Although there may be no symptoms, this type of cancer can cause blood, brown or watery secretions with an unpleasant odor. Cervical cancer can be easily checked with annual Pap smear test and HPV test. When the abnormal odor of the vagina is caused by infection, it appears after a short period of infection. Mainly, women do not experience any symptoms, 85% of women with trichomoniasis and half of those with bacterial vaginosis are asymptomatic. According to research, bacterial vaginosis and yeast infections are not sexually transmitted. This means that the only cause of abnormal vaginal odor that may be transmitted during sexual intercourse is trichomoniasis. Its first symptoms, including abnormal odor, 5 to 28 days after the person is infected, visible and inhalable. Golden tips. Taking the following substances makes the vagina smell bad: garlic, onions, asparagus, coffee, alcoholic beverages, spicy foods. Do not use vaginal shower. Consume plenty of water, watermelon and fresh vegetables. No consumption of fried foods. Urinate immediately after sex. Washing clothes with non-fragrant chemicals. Wash from top to bottom, from the vaginal area to the anus, due to the lack of contamination from the anus to the vagina.